Good morning. Good morning, everyone. And I should say good afternoon because I think we have people online from all over the world. Good morning, good afternoon, everyone, and welcome. Welcome to Capitol Hill. We're excited that we have people joining us via Zoom and also online via YouTube. My name is Anjali Achraker, and I serve as the Deputy Executive Director at UNAIDS, and I'm also serving as one of the co-moderators for today. Welcome to World AIDS Day 2023, Congressional, Commemoration, and Ministerial Roundtable. Today's event is organized by both UNAIDS in partnership with the State Department's Bureau of Global Health Security and Diplomacy, and it's co-hosted by members of Congress. We want to thank the following bipartisan members of Congress for co-sponsoring this event: Representative Lee, who will be joining us shortly, Representative Bera, Representative Spanberger, Representative Fitzpatrick, and Representative James. And a very special thank you to Chairman of SFRC, Senator Cardin, and his entire team for arranging this wonderful room and for connecting this event to everyone joining online. This is a special event. Today is part of a beautiful week where we commemorate World AIDS Day on December 1st, which is tomorrow. It is the 35th World AIDS Day. It's a day where we come together to commemorate the 39 million people that are living with HIV, but also to honor and respect the 40 million people whose lives have been lost to AIDS-related illness. We're together to highlight the decades of bipartisan leadership and support by the U.S. Congress for the global HIV response and tremendous leadership by American people in the global HIV response. We are here to recommit our support to the HIV response, our support of PEPFAR, the United States President's Emergency Plan for AIDS Relief.
Thank you very much, Anjali. My name is Mamadi Yilla. I am a Deputy Coordinator in our Bureau for Global Health Security and Diplomacy at the State Department, the new home for the PEPFAR program. We want to start today's commemoration with remarks from our esteemed members of Congress. We know how very busy you are. We are very grateful for your leadership and your support. Our first speaker will be a respected member of Congress, Senator Bill Cassidy, who is also a medical doctor. In June, Senator Cassidy led 19 bipartisan colleagues to call for the reauthorization of PEPFAR and highlighted the importance of ending mother-to-child transmission of HIV. He's a powerful advocate for PEPFAR, for HIV, for maternal and child health. Senator Cassidy, you have the floor.
Thank you very much. You emphasized that respected member of Congress. I don't want to suggest that other members of Congress are not respected. I actually have a long kind of personal history with HIV in the sense that when I graduated from medical school in 1983, the first article came out in the New England Journal of Medicine about an unknown disease that had this incredible negative effect upon someone's immune system with this kind of crazy cancers and infections that were resulting. And it was a curiosity. But then I moved to Los Angeles to do my medical residency, and it just hit the gay community, boom. And it was so kind of desperate. You didn't have a test to test for it. All these men were my age. And they were dying. It was really kind of and we knew, by the way, that if someone had the syndrome, they were going to die. That was the young doctors saying that. Why are we doing anything? Because they're going to die. The older doctors, the fellows with the gray hair, there's some advantage to having gray hair, knew that driven by compassion, that science and programmatic change would bring hope. And we saw that. And we saw that and while I was out there, I was involved as kind of a worker bee on doing some clinical trials for a new drug called AZT. After it was first reported, I bought some stock in the company. My wife sold the stock to buy a couch, And anyway, the couch has been discarded and the stock price is this high, but that's another story. But the point is the compassion driving science and driving programmatic change brought hope so that when I was still in Los Angeles, Magic Johnson was diagnosed with HIV and Magic Johnson's still alive. So it went from a few short years from if you had the diagnosis, you were dead. Why are we doing anything? To now we live with it and someone who has it will die when they're 80, but not when they are 25. Fast forward, my wife and I married, we went to Swaziland in Africa. And at that time, it was incredible. There'd been incredible disruption of the society. People were coming from Mozambique for healthcare at the missionary hospital where we were. And I just would see 90 patients a day, literally, and 80 of them would have a sexually transmitted disease. And HIV had not entered that portion of Africa, but I knew when it did, it was going to go. It was just going to go. And sure enough, it did. And then I returned and I worked in a hospital in Baton Rouge, Louisiana, which was for the uninsured. And at that time, the disease had migrated, if you will, from the gay man to the African to the heterosexual and IV drug using population of the lower socioeconomic class. And I had seen the whole spectrum happen. Now, all of this could just make you just desperate. But instead, compassion driving science and programmatic change brought relief first to the gay man, through PEPFAR to Africa, and through continued efforts, Ryan White, for example, through other populations. So again, it is now a disease that if you take your medicine, you live with and you die with when you're at an advanced stage, but you don't die with it early. I think that now presents us to the next challenge. One, we have to reauthorize PEPFAR. Just because you have had success, we know that the success must continue. If you stop taking your medicine, you don't live to that old age. And PEPFAR is so important. I think it's also important to realize that it's now evolved in Africa to a mother and baby disease, that we've reached the populations most at risk, but now it's that mother and child. And I feel like as I've gone through being a 28-year-old medical resident to a 30-year-old doctor in Africa, to practicing for 2 decades at my public hospital, and now the cycle is I'm a senator, I've seen this disease migrate. The challenge before us is by compassion to continue to use science and programmatic change to reach a new at-risk population. Our goal is to eradicate HIV, but it's going to be one population at a time, and within that population, one person at a time. I thank you for all your efforts. I look forward to partnering. I look forward to next time us being able to speak of the success we've had with mother and child, and hopefully after that, there'll be no new population to reach. Thank you.
Thank you so much, Senator Cassidy, for those powerful, powerful reflections and your history, your long history and support of the HIV response and of PEPFAR. We now will move to our next highly respected and regarded member of Congress, Representative Michael Lawler. Congressman Lawler represents a new generation of leaders in the U.S. Congress supporting HIV and global health. In July, Congressman Lawler worked with Representative Spamberger to lead a group of 75 bipartisan members of the House to call for the reauthorization of PEPFAR. We want to thank you for that, Representative, and also hand the floor over to you.
Well, thank you so much, and good morning. And thank you all for being here today in recognition of World AIDS Day and to honor those who have gone before us. I recognize the contributions of those here today to fight against AIDS and to rededicate ourselves to ending AIDS as a public health threat by 2030. Programs like PEPFAR have made significant strides in the past 20 years, and we're at a point now where that reality is within grasp. And, you know, you think back to President Bush announcing this program 20 years ago, and now it coming up for reauthorization this year. And we have had a lot of great success over those 20 years. And thanks to PEPFAR, other HIV/AIDS programs, and the dedication of those in this room, over 20 million lives have been saved. Transmission to 5.5 million babies has been prevented. and a number of countries have been able to surpass UNAIDS 90-90-90 treatment targets. I want to thank the ambassador who recently announced an initiative, Safe Births, Healthy Babies. This effort will both scale up maternal child health care and help eliminate mother-to-child transmission. PEPFAR is a testament to the leadership and generosity of the American people. And this new initiative shows that we aren't going anywhere. This is tremendous progress and all the more reason why we shouldn't stop now. And I will continue to work with all of my colleagues in a bipartisan way to get this done. Now, I was born in 1986, and in 37 years that I've been alive, obviously we have seen tremendous change with respect to this deadly disease. And while we are looking at 40 million lives lost over that time, the fact that 30 million are living with HIV/AIDS today, and the fact that over 20 million lives have been saved is a testament to how important this program is, how important the investment is, and how critical it is going forward if we are to truly eradicate AIDS as a public health threat in the coming years. So I want to thank everyone for being here and certainly for all of your hard work on this important issue.
Thank you very much. We continue to acknowledge our respected members of Congress who have joined us. And next to speak is Representative Sarah Jacobs. Congresswoman Jacobs is a powerful voice in Congress for Africa, for global health, and for PEPFAR. Even before she was elected to Congress, she had expressed her determination to be the generation that ends HIV and AIDS once and for all. Congresswoman Jacobs, we're delighted to have you here. You have the floor.
Well, thank you so much. And I am so delighted to be here with all of you to recognize World AIDS Day and PEPFAR's success. You know, we talk a lot about how many lives PEPFAR has saved in the last 20 years, 25 million. That is incredible. And while saving those lives alone would be enough, the return on investment has actually been so much more than that, right? We've seen an investment in healthcare systems and infrastructure, in global supply chains, in training and jobs and healthcare personnel. And I think it's important that we recognize also that PEPFAR is responsible for ensuring our safety, security, and stability. Because healthier communities are more stable and prosperous, they're more likely to have good governance, a productive workforce, increased economic development, all important factors to avoid conflict and stability. And so while the health strides for PEPFAR have been incredible, PEPFAR is so much more than a health initiative. It's an investment in our national security, in trade, in peace, and it's a shining example of what positive U.S. global leadership can and should look like. So that's why I'm hopeful that we can pass a clean bipartisan reauthorization of PEPFAR to continue this leadership and support our partners on the African continent and around the world. As the ranking member of the House Foreign Affairs Subcommittee on Africa and a member of the Subcommittee on Global Health, Global Human Rights, and International Organizations, I'm doing everything I can to build support for this important bipartisan initiative. I've traveled to the African continent half a dozen times just this year, a lot of flight miles, including recently to Tanzania, where I went to visit the Temeke Regional Referral Hospital and Buza Ward Office with Chairman John James. And we both saw up close the incredible life-saving work of PEPFAR. And it was so inspiring to see the impact of this funding, to see the lives transformed and changed and saved. So I'm so happy that we are commemorating this, that we are celebrating this, that we have this renewed energy to continue PEPFAR and work to get this clean bipartisan reauthorization. You can always count on me for my support. And I'm just so honored to be doing this work alongside all of you incredible people. And I truly believe that together we are going to create an AIDS-free generation. So thank you so much.
Thank you so much, Congresswoman Jacobs. And what an exciting reflection with the country experience that you just shared as well from Tanzania. I know the ambassador, we were recently there at Temeke as well to see how powerful that was. Okay, so we are so grateful that we're having a number of representatives and senators coming in throughout the program today. They will be coming in at various times. And so if you'll allow me to just keep moving us forward, and we will pause when different representatives and senators come in. So we'll continue on with the program, and I'll turn to Mamadi. Thanks.
So in our next segment, we want to move to a distinguished panel of global leaders in HIV health and development. They will speak to us from various parts of the world, as well as from here in Washington, D.C. At this time, we were to invite the executive director of UNAIDS. I believe she is stuck in a train in London. And Anjali, if she doesn't come on, we're going to turn to you to deliver her remarks on her behalf. Anjali? Okay.
All right. So I will step in on behalf of our executive director, Winnie Byanyima, who, as many of you know, has been a long time supporter, advocate, and champion in the HIV response globally. She is the executive director of UNAIDS, which, of course, UNAIDS represents 11 different UN agencies, different sectors that have all come together with one common mission to fight HIV and AIDS globally, and to work together with PEPFAR Global Fund, partner countries, and communities. So I'll offer a few remarks on her behalf. As I said earlier, World AIDS Day really offers a moment for all of us to pause and stand in solidarity and support of the 39 million people that are living with HIV, and also to remember and honor the 40 million lives that have been lost. It's also an opportunity for us to come together to really reflect on and celebrate the incredible progress that has happened because of the global HIV response, because of the partnership, because of PEPFAR. What we've seen over the past 20 years has been remarkable. We have seen AIDS deaths plummet by nearly 70% since their peak. We have seen new infections, while still rising, lower than they've ever been. This is a testament to the response, the success of the response, and the success of PEPFAR. Of the 39 million people that are living with HIV, 30 million people are on life-saving treatment across the world. That is extraordinary. Those lives, those cherished lives, are mothers, fathers, babies, school teachers, doctors, productive members of society. We still have work that needs to be done. There are 9 million people in need of treatment. We are still needing to close the gaps with children, adolescent girls, young women, as well as key populations. We still have 1.3 million new infections that currently happen every year. We have to continue the fight. But let's not lose sight of what platform and what incredible progress we have. Like we heard Senator Cassidy and Representative Lawler and Jacobs say, the success is extraordinary. It's not just the HIV outcomes that we've seen progress on, but we've seen incredible health systems that have been put in place, laboratory systems, surveillance systems, supply chain systems, healthcare workers, community health workers, community that has been put front and center in the response. These are systems for health that give for HIV, but also help protect countries from other diseases in the future. So again, it's bringing Winnie's remarks, bringing Winnie's perspectives, but just to say how incredible this response has been. We cannot let our foot off the pedal now. We have to continue to accelerate to get to the end of AIDS as a public health threat by 2030. We must move with urgency, and we should celebrate this incredible gift that we have that keeps on giving, and we should not let go of the power of what PEPFAR is and what the global HIV response is. Thank you.
Thank you very much, Anjali. And as Anjali mentioned, we will have members of Congress continue to come in. We have a couple on their way. But in the interim, it is really my pleasure to welcome next to the floor Ambassador John Nkengasong, who is the U.S. Global AIDS Coordinator, and he's also the Senior Bureau Official for our new Global Health Security and Diplomacy Bureau at the U.S. Department of State. Ambassador, we are pleased to invite you to make some remarks.
Thank you, Mamadi. And let me perhaps start by acknowledging those who are on the line. I think there are several ministers from different African countries that have been kind enough to join in. The Minister of Health of Tanzania, let me recognize her presence. Minister Omi Mwalimu, Minister of Health of South Africa, Honorable Joseph Fowler, and Minister of Health of Mozambique, Dan Tiago. I also like to recognize the Deputy Chair of the African Union, Dr. Monique Nsazabagawa, who is also on the line to express their message of solidarity and partnership with all of us. The fight and our journey and fight against HIV/AIDS over the years, as the theme of this World AIDS Day dictates, which is to remember and commit, is a journey of hope. I'm very pleased that, and I wish he was still here, that Senator Cassidy led us with a message of hope. And hope, as I said last night, that is underpinned by solidarity, partnership, innovation, and values, our values. I'm also happy that Congresswoman Jacobs expressed and echoed those sentiments. Our struggle and fight against HIV/AIDS symbolizes what is possible when we have unity of purpose, when we have a strong bipartisan support for a program that has lasted for 20 years, and the results are obvious. The journey represents what is possible when good politics and good public health all come together to create an impactful outcome. Needless to cite the numbers that we've been citing all through the year, but it's remarkable. Someone yesterday, I think it's Emily, said that PEPFAR has become the gold standard for humanity. And I agree with that. I think it's truly a gold standard of humanity. What else, over the last maybe century, in terms of a public health program, has saved 25 million lives, prevented HIV infection from infected mothers to infants that are born healthy? What else has strengthened health systems very broadly than the power of PEPFAR together? And Anjali cited some of those health systems that have been strengthened that we are using today to respond to multiple syndemics, non-communicable diseases, emerging infectious diseases, including the recent COVID-19 pandemic. Going forward, we have to work hard to sustain the response. We have to work hard to sustain the response. And because the gains we've made, we've all heard this morning, are fragile. And we have to do that in 3 dimensions. One is political sustainability. Continue to engage the political leadership. And I'm very pleased that Congresswoman Lee just walked in. Thank you. I want to acknowledge that because It is through such an act of political leadership that we are here today. When Congresswoman Lee, on 18th of December 2022, you wrote a letter to President Bush, and you and about 30 Congressional Black Caucus members saying, President, we have a disaster unfolding in Africa. That kicked off that whole momentum of the president announcing PEPFAR in January of 2003. So thank you so much for that leadership. It's the kind of political leadership that will continue to be required as we sustain the gains that we've made over the years, which we all know are fragile. The second thing we must do is a programmatic sustainability. Sustaining the gains we've made means that we have to use an evidence-based, data-driven approach to look at priority populations, the children. We just launched the Safe Babies, Healthy Babies initiative. We need to look at adolescent girls and young women and look at key population at a much granular level, which is driven by the power of our data, which is to say that what kind of efficiencies do we have? The same processes that we used 20 years ago have yielded results, but it's taken us to a different place that we must use data and continue to unpack where we apply them. As Congresswoman Jacobs said, and I can't agree more with her, that the fight against HIV/AIDS is a health fight, it's a security fight, it's a developmental fight. It's all combined. It's a combination of that as we move forward to the hopefully the last mile, which is our journey towards 2030, which continue to look at programmatic sustainability in terms of truly the partnerships and leadership that the countries that we've worked with, the partner countries, will play a leadership role, both in terms of programmatic implementation and financial contribution. And lastly is the financial lens. For the gains we've made to be sustained, we need to continue to have joint responsibility and joint accountability, which is to say that partner countries will continue to increase their domestic financing and will continue to work with them with the resources that we have so that we get to that journey of ending HIV/AIDS as a public health threat by the year 2030. Let me end up with a message of hope, as Senator Cassidy said, which is that hope dies last. And we continue to remain hopeful that we'll get a clean 5 years reauthorization that will enable us, Congresswoman Lee, to bring this fight to an end so that when we meet here in the next couple of years, we'll be here to celebrate the end of the only other disease, perhaps, that have been eliminated or eradicated other than the smallpox. So thank you so much for the time and leadership you continue to play in this critical response.
Thank you so much, Ambassador Nkengasong, for your remarks and for your extraordinary leadership of PEPFAR. I have the great honor and pleasure of introducing Congresswoman Barbara Lee, who's been a leader and advocate in the U.S. Congress since 1998, but has been a champion for the HIV response from the very, very, very beginning. It is because of you that we stand here today and are able to celebrate the success that we've seen from the very beginning. You are known as the mother for PEPFAR, but also for UNAIDS, for Global Fund as well. So without further ado, the floor is yours. Thank you, Congresswoman.
Well, thank you so much, Angeli, for that very warm introduction. But let me tell you, this couldn't happen without you, all of you, without our activists. And it's all brought us to this point where we know that we have no option. This is about really saving lives. And so the work that I've done over the years has just been my mission. Again, we all know that we have the opportunity to see an AIDS-free generation by 2030. And so we have to do everything we can do to get there. So thank you for that introduction. And Ambassador Nkengasong, I want to pronounce your name properly. And thank you for your leadership. It's good to see you. And thank you for recognizing the role of the Congressional Black Caucus, because it's very important that history is recorded correctly as it relates to how this initiated, but how we got to this point. And it was a bipartisan effort. It was led by the Congressional Black Caucus. And I'm really pleased that this effort continues as a priority of the Congressional Black Caucus, and of course, myself, who's also a member. And so all of your longtime work to end HIV and AIDS, it's very, very inspiring. So thank you all so much. Everyone here today, let me just thank all of you for tackling, hi Sandy, your commitment to addressing worldwide HIV and AIDS. And I was on my first visit when I first came to Congress was with Sandy Thurman. It was a congressional delegation looking at the devastation of the pandemic as it relates to orphans and vulnerable children. And from that day forward, all of us said that we had no option but to make this a priority in our work. Every year on December 1st, people across the world unite to renew our commitments to our fight to end HIV and AIDS. As we show support for people living with HIV and AIDS and combating the stigma, we also honor and we can't forget the memory of all of those who have died from AIDS-related diseases. World AIDS Day was first observed in 1988, which is a decade in which the average life expectancy for someone with AIDS was 3 years after diagnosis. 3 years. 35 years later, AIDS-related deaths have been cut by almost 2/3, and new HIV infections have been reduced by more than a half. Many of you, including myself, have been in this fight for many, many decades. 20 years ago, yes, I did work with President Bush and with the Congressional Black Caucus and many others to first enact PEPFAR. PEPFAR has been and continues to be having a profound and transformational investment. It is transformational, saving more than right now today, 25 million lives. That's really remarkable. It took us 20 years, but that's what all of you have done. And so we've continued to provide care for more than 7 million children orphaned by HIV and AIDS. We established actually the Office of Orphan and Vulnerable Children after we came back and witnessed what was taking place as it relates to children left with no parents as a result of HIV and AIDS. Congress wrote the legislation and provided the funding, but the actual work has been done by countless care providers, activists, and advocates who have fought against stigma to ensure everyone gets the care that they need. Despite these achievements, this year on World AIDS Day, it's really different from past years. We're stuck now. Congress is, unfortunately, in a stalemate, putting the progress of our fight to end HIV and AIDS at risk. And so you all know how much of an effort we put into making this a bipartisan initiative. And so I'm continuing to work with my Republican colleagues over and over again, each and every day, to extend PEPFAR on a bipartisan basis. But there are some roadblocks right now. Of course, Congressman Meeks, ranking member of the Foreign Affairs Committee, and I were actively engaging with Republicans and the Biden administration to enact, as the ambassador said, a clean 5-year extension. And most Republicans that I speak with understand the value of PEPFAR and are committed to its success. But yes, being very, well, candid, but it's very clear and very obvious to many that there are some outside opponents. They're spreading misinformation, disinformation about PEPFAR to advance their own narrow agenda. And I'm here to tell you that we're not going to let them derail this life-saving program. The well-being of millions of adults and children in Africa around the world are on the line. We have a 2030 deadline ahead of us. And even though there were some setbacks during COVID, we're back on track, and we know that we still can achieve an AIDS-free generation. The activists and caregivers, they're not slowing down their effort to end this pandemic. They're not losing their focus, and we must not lose our focus either. So today, let's recommit ourselves to making sure that Washington doesn't get distracted. No one else is around the world. Let's make sure that we stay laser focused on the fight to end HIV and AIDS. The pandemic, it's still a pandemic for everyone in the world by 2030. And so thank you all again for really hosting this, but also recognizing the roadblocks where we are right now. But just know with your help, we'll be able to break through, and we'll be able to continue to make PEPFAR a bipartisan bill, bipartisan funding, so that we can achieve our goals. And that's about saving lives and ending the pandemic. So thank you again. And I'm really pleased to be joined by my colleague, Dr. Congressman Ami Bera, who I co-chair the AAPI, the Asian American Pacific Caucus Health Task Force. So thank you again. Thank you for your leadership.
Thank you. Thank you so much, Congresswoman Lee. And on behalf of that workforce that you referenced, we will continue to do our work, and we will hope for the best from you and your colleagues. Thank you, ma'am, so much. Next, we would like to acknowledge the arrival of our respected Congressman, Ami Bera, who, as the Congresswoman has just said, is an American physician with a 20-year career in medicine. He has served in the House for the last decade. He is co-chair of the TB Caucus and a founding member of the Global Health R&D Congressional Working Group. Congressman, you have the floor.
Yeah, thank you. On this 35th World AIDS Day, let's take a moment and just remember the millions of lives that have been lost to this deadly disease. When I think about my early days as a medical student in the mid-'80s, as a resident in San Francisco in the early 90s, this was a death sentence. But fast forward to where we are today and what we can do. This is a chronic condition. This is a manageable disease. And it's not fair following Congresswoman Lee, because she reminds us of what's possible when we lead with moral clarity, when we lead with the courage to do the right thing. Nobody ever would have thought Congresswoman Lee and President Bush, probably very different philosophically on the political spectrum, but they came together in a moment of moral clarity and moral leadership to do the right thing. And if you were to ask President Bush today what his greatest legacy is, it is PEPFAR. If you were to ask me what has, I was in Africa this summer, what has been the best investment that we've made on the continent of Africa that's created goodwill, that's led with moral clarity in terms of saving millions of lives? It's PEPFAR. And it's far beyond just addressing the scourge that is HIV/AIDS, because those investments go far beyond that. It builds infrastructure, it builds assets, it takes the talent that is there on the continent to then address so many other healthcare needs, to train up a public health workforce. So, if we do not reauthorize PEPFAR, if we do not, you can't reauthorize it in a 1-year timeframe either, because you do need that 5-year clean reauthorization, which historically has always been bipartisan and nonpartisan. There's the urgency of now to do this, because failure to do it sends exactly the wrong message to the rest of the world at this particular moment in time. And that's why, again, it is my honor to certainly call Congresswoman Lee a friend, a mentor, but an example at this moment in time when often folks will think, well, you can't get that done. How is Congress going to get it done? We're going to get it done because it is the right thing to do. We have moral clarity. We know the majority of the members of Congress, Democrats and Republicans, House and Senate, understand we need to do this. And then we just have to find the moral courage to do what's right. And doing the right thing is always the right thing to do. So we will get this done, and we have so much more to do. So thank you for the leadership of the folks that are here. Thank you for the advocacy. We can make this a better world. We just have to, again, have that moral clarity and moral leadership, and we'll do it. Thank you.
Thank you so much, Congressman Bera, and really for reminding both of you for reminding us what's possible with moral clarity and how important saving lives is. It's been a partnership, a global partnership, and online, as the ambassador had said earlier, we have ministers from all over the world. We also have global leadership from UN agencies that have been part of the global response. It's my pleasure to now introduce our next speaker, who's joining us online from New York, Mr. Akim Steiner, who is the administrator of the United Nations Development Program. Akim is leading UN efforts to promote inclusive and sustainable development. And UNDP is a critical partner of UNAIDS, but also of the entire global HIV response. So with that, I want to welcome Akim. You have the floor.
Thank you, Anjali, members of Congress, Ambassador Nkengasong, honorable ministers who have joined from around the world, my fellow panelists. Let me simply pick up from where you have all so eloquently already spoken, but particularly to use the term celebrate just for a moment. There is not much to celebrate in our world right now, but I think when we talk about PEPFAR, as many of you have already alluded, it is an extraordinary success story. And it is one, if you allow me for a moment, that speaks also to those moments in US political history when the people of the United States come together, when the Congress and the executive come together, and extraordinary things are done with wisdom, foresight, compassion, moral leadership, and simply leadership, personal leadership. And the reason I want to, for a moment, draw an analogy, which is in the history of, let's say, the last 80 years, one that I would consider to be of a parallel. The Marshall Plan after the Second World War, an extraordinary moment of generosity, of wisdom, of foresight in the US taking that exceptional decision to invest in the reconstruction of Europe. When we look today at PEPFAR's equivalent role that it is playing in addressing HIV/AIDS, this is not an analogy that does not have parallels. It is an extraordinary act of bipartisanship of the United States, and with PEPFAR over the years having stepped up to the point, as many of you have alluded, having already saved millions of lives. We sometimes forget what it means to have 21, 22, 25 million of lives saved. These are men, women, children. Numbers become very abstract. It's an extraordinary success story. And as Congresswoman Jacobs and others have alluded to, it goes beyond the direct response to the disease. It actually is an integral part of helping societies address vulnerabilities, risks, but also their development prospects. Over the years, PEPFAR has helped to train 340,000 health workers across the world. It has helped countries to build disease resilience, and we saw that both during episodes such as Ebola, but also during COVID. And I also want to recognize how significant PEPFAR's investment has been in complementing, triggering, and catalyzing also significant investments by countries themselves. We would not be with the HIV response today if it was not for that co-investment. And therefore, as a head of the United Nations Development Program, working as part of this joint program, we very much recognize the significance, as Congresswoman Jacobs also alluded to, that this is as much about health as it is about a country's future economic development, as it is about governance, fundamental human rights. And I think this is something that we need to convey more clearly also to the American people, because it is a success story that perhaps we celebrate too little. Two more remarks, if you allow me to make them. We have learned a lot along the way, and the multi-sectoral approach is not only one in terms of global geopolitical, geosecurity considerations, it's a very practical one also in how you help communities to build resilience. This year's World AIDS Day is celebrating the role of communities, and I would like to highlight how significant that lesson and that journey is that we have learned over the years. This is not just a state health system providing antiretrovirals. It is in fact having communities lead increasingly the response to HIV/AIDS. And countries such as Botswana and Zimbabwe are remarkable examples over the years where the putting of communities first has been central to the success story. And they have recently exceeded the 95 testing and treatment targets ahead of the 2025 deadline. Another example is from Nigeria, where community-based organizations were associated with a 64% increase in access to HIV treatment. And I could continue with many other examples. Let me also speak to one other element, the partnership between PEPFAR and the joint program partners such as the Global Fund. Together, we are reaching over 30 million people today. It is an extraordinary success story, and sometimes under the most testing of conditions. In our partnership with the Global Fund, we are working today in major crisis countries where HIV is essentially a death sentence if you're not able to access treatment, whether it's in Sudan, in Afghanistan, in Yemen, in other countries. Even in those extremely difficult circumstances, the partnership that PEPFAR has helped to create globally is today also with our UNAIDS partnership, delivering to people that otherwise would not simply have had a chance to survive. Let me end by just making one more comment, which is in celebrating PEPFAR, I think it is, and you will hear from ministers of health in a moment and from the African Union Commission, also an extraordinary success story in how countries themselves are co-investing. We would not be where we are today if it was not for the leadership, first of all, of PEPFAR and others who have brought the kinds of means with which to address this challenge of our time, but also the recognition by countries, by governments, parliaments, by citizens in developing countries that this is something that they ultimately are the leaders of implementing. And it is in those partnerships that I think we have seen some of the most remarkable breakthroughs. And in celebrating World AIDS Day, let us celebrate both what I think at the beginning Senator Cassidy referred to, compassion on the one side, but also leadership. And Congresswoman Lee, you also spoke about the Congressional Black Caucus. It is these moments of leadership when we look beyond partisanship and we also see the value of preventive action. PEPFAR is even more than perhaps the Marshall Plan was, an ultimate illustration of preventive action. And it is in that spirit that we in the United Nations join you today to celebrate US leadership, the leadership of people across the United States in having joined the fight on HIV/AIDS in a way that has really no parallel. So in that spirit, thank you again for inviting us to join you today. And we look forward to continuing this extraordinary partnership and journey. Thank you.
Thank you very much. We now have 4 distinguished leaders from across the continent of Africa, the Deputy Chair of the African Union Commission, and 3 ministers of health who will be joining us. These ministers are leading some of the largest and most complex HIV and health programs in Tanzania, in South Africa, and in Mozambique. And we as PEPFAR are privileged to join them in their efforts at fighting HIV/AIDS in their countries. But first, we will turn to our distinguished representative from the African Union, Monique Zanza-Baganwa, the Deputy Chairperson of the African Union Commission, who is speaking to us from the African Union in Addis Ababa, Ethiopia. Deputy Chairman, welcome, and you have the floor.
Thank you so much for welcoming me. And let me stand on the pre-established protocols to greet you, esteemed members of the Congress, honorable ministers, ambassadors, distinguished guests, and tell you how much it's a pleasure for me to be part of this year's Congressional Commemoration and Ministerial Roundtable on this significant World AIDS Day. And in commemorating this day, we must acknowledge the remarkable leadership and collaboration between the African Union Commission, the US Congress, the UNAIDS, the Global Funds, and others in working together to combat HIV/AIDS. And their collective efforts, including through the US President's Emergency Plan for AIDS Relief, PEPFAR, have played a pivotal role in shaping the global response to the epidemic. I want to recall where we started. How in Abuja in April 2001, heads of state and government of our continent declared that HIV/AIDS was not just a health threat, but it was an economic, a developmental, and security threat. to the continent. HIV/AIDS indeed had dramatically reduced life expectancy, slowed the GDP per capita growth significantly, and created high numbers of orphans. HIV cost the continent a generation of educators, and overall HIV/AIDS had impacted the lives of millions of our citizens. No wonder HIV/AIDS was declared a global security threat through the UN Security Council Resolution 1308. Investments through PEPFAR and the Global Fund, more than $110 billion to date, helped control HIV transmission against SDG 95 goals and produced trained health workers, strengthened the clinics and facilities, and at the community level, broadened the laboratory capacity to attack COVID-19 when it struck, Ebola and other fast-moving outbreaks as well, and crucially had helped improve the development outcomes that had come along with it. We have the statistics to prove this. For instance, antiretroviral treatment provided HIV life-saving therapy to over 20 million people. And HIV-positive mothers gave birth to over 5.5 million HIV-free babies and saved the lives of over 25 million people. And this support has not only had a health impact, but has had a measurable impact on the continent's development as well. With PEPFAR support, member states also experienced significant increases in childhood immunization rates in 3 areas, a 9% increase in measles immunization, and 11% in DPT, and 8% in hepatitis B immunization. And PEPFAR was also associated with a decline of 9.2 percentage points in the out of school rate for girls of primary school over the period. The African Union welcomes this acknowledgement of 20 years of United States government leadership in the fight against HIV/AIDS and its dedicated and sustained partnership with member states of the African Union. To date, Africa has received about 81% of the funds from PEPFAR, including the Global Fund. And over the past 20 years, this is really, really tremendous support, for which we thank the American people and the American government. The bipartisan support of the US Congress has been essential to our progress. Many members of Congress and staff have visited member states, and we have heard testimonies from this very meeting. And these states that received PEPFAR support have shown how the sustained progress they managed to achieve through this partnership. And we count on the continued support of the US Congress through PEPFAR so we can reach the 2025 targets, but most importantly, reach the realization of the Agenda 2063 second 10-year implementation plan, and also ensure the sustainability of HIV response to 2030 and beyond. But we are not standing idly by. Beyond mere policy frameworks, the African Union Commission continues to actively champion the implementation of continental initiatives, such as the Campaign for Accelerated Reduction of Maternal Mortality in Africa. And we have, as you may know, recently established the Agency for Medical Supply, AMA, and the Commission is further co-championing Free to Shine campaign with the Organization of the First Ladies, just to name few initiatives. And additionally, we have taken up the call for increased domestic health investment, dismantling the barriers to care for the most vulnerable groups, such as adolescent girls, children, and key populations, seeking efficiencies by prioritizing coordination and collaboration, accelerating manufacturing of health products in the region, and creating a sustainable platform for service delivery that can address all the health threats of our citizens, and committing to maintaining the gains of the past 20 years. As I conclude, let me say that this World AIDS Day serves as a solemn reminder of the millions of lives affected by this devastating disease. And it is a day of remembrance, of solidarity, and renewed commitment to achieve an AIDS-free generation. And the African Union Commission's unwavering commitment to addressing HIV/AIDS is commendable. With Africa bearing a significant burden of the disease, the Commission's leadership has been instrumental in shaping policies, mobilizing resources, and promoting regional cooperation to combat the spread of HIV/AIDS. And the collective efforts of the Union, supported by the Commission and its partners, have resulted in innovative strategies, improved access to treatment, and strengthened health systems across the continent. PEPFAR is such a tremendous supporter and partner. Let me request that we finish the fight together and we continue this partnership over the next years leading to 2030 and beyond. And I thank you.
Thank you so much, Deputy Chairperson. We are really honored that you were able to join this morning and deliver those remarks. We want to next celebrate the leadership of, actually we want to acknowledge your presence and to tell you how much we look forward to meeting with you in Kigali for your upcoming summit on HIV. Our next speaker is the Honorable Minister of Health of Tanzania, Minister Umi Mwalimu, who is a Tanzanian politician and serves as the Minister of Health, Community Development, Gender, Elderly, and Children. Minister, we welcome you and you have the floor.
Thank you very much, Mamadi. Good morning and good afternoon, because here in Dar es Salaam is the afternoon. Respected members of the Congress, Ambassador Nkengasong, Honorable Ministers, Madam Deputy Chairperson of the African Union, respected participants, habari za mchana, good morning, good afternoon. Kindly excuse me for my voice, but let me begin by thanking the organizers for inviting Tanzania to be part of this roundtable commemorating World AIDS Day. And first of all, I'd like to thank the government of the United States of America for the significant support to the people of the United Republic of Tanzania, especially in the fight against AIDS. Since the launch of PEPFAR in 2003, the US government has invested nearly 7 billion to Tanzania, USD, has invested nearly USD 7 billion to Tanzania in the fight against AIDS. The support has had a great impact to reduce AIDS-related death by almost 80% since 2003, and new infections by almost 70%. In 2003, before PEPFAR was operational, less than 1,000 people in Tanzania were on antiretroviral therapy. To date, I'm very pleased to say that more than 1.5 million Tanzanians are receiving this life-saving treatment for HIV, and it is mainly because of the support we are getting from PEPFAR. We are very grateful to the members of the US Congress who visited Tanzania earlier this year and witnessed the good work in responding to the burden of HIV that is being implemented through support from the American people. infections prevented by HIV program from 2003 to 2023 is almost 2.2 million. Death prevented by HIV program from 2003 to 2023 is almost 1.5 million. This translates to millions of family livelihoods sustained and reduced huge burden on the health systems and budget. Ladies and gentlemen, we all have set the path to the ending HIV/AIDS. Compared to 2010, there is a reduction of new infection by half among adolescent girls and young women. 44% new infection reduction among adolescent boys and young women, and 58% reduction among children globally. This is huge gain that needs a round of applause. The decision is in our hands now to go to the last mile by sustaining the gains made by prioritizing investment to build resilient system, particularly for the groups that are left behind, especially here I'm talking about children and adolescent girls. At the moment, 43% of the 1.5 million children aged between 0 to 14 years living with HIV globally are not receiving life-saving treatment. And 1.4% of these 79,000 children, 21,000 children are in Tanzania. Adolescent girls and boys and young women and men and other populations most at risk are still disproportionately affected and are lagging behind in the coverage with ART and interventions for prevention. Ladies and gentlemen, Tanzania would like to reaffirm its commitment to the continued partnership with the United States government through PEPFAR and other partners such as the Global Fund to Fight HIV Tuberculosis and the UNAIDS in the effort to develop and implement a sustainable roadmap for HIV and AIDS. This will require continued investment by partners to consolidate HIV epidemic control and ensure that no one is left behind. The investment such as DREAMS has been a reason for the success we celebrate today, but they are limited in coverage across the country. We strongly encourage successful programs as this to be scaled up. Ladies and gentlemen, Tanzania would like to call upon the US government through US Congress to reauthorize PEPFAR for another 5 years. This will enable countries like Tanzania to achieve epidemic control and end AIDS by 2030. Our clear appeal to the Congress, to the US Congress, is to reauthorize PEPFAR in order to sustain the gain we have achieved. And tomorrow, during the World AIDS Day, we are going to release country data on the state of HIV/AIDS in Tanzania. We have made great progress. We want to do more. Without PEPFAR, we can't do what we have planned to do. I have personally seen the benefit of PEPFAR. The risk of not continuing to accelerate the HIV response will have implications outside of the health sector, but put also our economic and global health security progress at risk. Not ending AIDS is more expensive than ending it. Thank you very much for your kind attention.
Thank you so much, Minister Mwalimu. It's great to see you and for your powerful statement and your leadership throughout. It's been extraordinary. Thank you so much. Our next speaker is Minister Joseph Falla, Minister of Health of South Africa. Minister Falla has just released the latest data in South Africa showing Africa's progress towards the 95-95-95 targets. For the largest country with the largest HIV epidemic in the world, the progress is simply breathtaking. Minister Falla, welcome. You have the floor.
Thank you very much. Thanks, moderator, for this opportunity. Let me also greet the distinguished, host for this roundtable, Ambassador Nkengasong, Ms. Winnie Byanyima in absentia, but well represented, and all esteemed members of Congress. Very much appreciated for your very kind words and words of encouragement. And also, we like my colleagues who have spoken before me, we had the opportunity to host members of Congress earlier this year. We're very grateful that we have been invited to be part of this roundtable as we commemorate the World AIDS Day, but also indeed agree with previous speakers that there is a lot to be celebrated in terms of the progress we have made. We believe that this roundtable and all other activities around World AIDS Day indeed is the opportunity for us to remember where we come from, remember the lives we have lost, but also the lives which have been saved. The number of orphans who we have to look after, and take a moment to recommit to do more in terms of saving more lives. From us in South Africa, as already said in the introduction, that we have the biggest burden in the continent, but also in the world in terms of HIV and AIDS and TB, especially in terms of also co-infection of HIV, AIDS, and tuberculosis. We appreciate the partnership and the support provided by PEPFAR, which have made it possible for us as a country to roll out a huge treatment and prevention program. We're also encouraged by the fact that over time, as we engage with PEPFAR, the interventions have also been tailor-made to support our country's priorities, also including when we're dealing with the COVID pandemic. We have 27 districts in our country out of 52 districts which are supported by PEPFAR in the most burdened districts. And through this, we have been able to roll out, as of current, just around 5.8 million people on treatment for the antiretroviral treatment. Also, through this support, at the current moment, in terms of the current country operation plan, we are very grateful for the support of just around $456 million US dollars. And as other previous speakers, we really appreciate the 20-year relationship and very valuable support from PEPFAR. So we want to take this opportunity to appreciate this intervention by the US administration, but also Congress for over this many years of renewing this support and solidarity. It's indeed an international solidarity. So we want to take the opportunity to thank the people of the US, because we believe that Congress and the US administration could not be able to do this without the support of the ordinary American people. As a result of this intervention, we have made tremendous progress. As already mentioned earlier on, recently we had the release of a report from South African Human Science Research Council, which shows that indeed we have passed the 90-90. We are striving towards 95-95 by 2025. A lot of progress. A number of districts, including where I am currently, we're celebrating our World AIDS Day and commemorating it in the province of KwaZulu-Natal, which is one of the most burdened provinces in our country, doing a lot of progress. In fact, just a few minutes before joining this meeting, I was addressing a meeting of people living with HIV, civil society, and they were very much encouraged, and they said, I must tell you that they really appreciate the tremendous support which as South Africa we have enjoyed. And as a result of this, just in terms of over and above what I've mentioned about the number of people who are covered and living longer and healthy lives, just in terms of just over the last few months, we have been able to initiate just over 200,000 people on treatment, and also have just over 500,000 people who are now experiencing viral suppression. But they still have a lot of challenges, and we still have a lot of gaps especially in as far as making sure that more men come forward to be tested and to be put on treatment. We're closing that gap. We're making sure that our public health facilities are ready for young people, because in as much as the report indicates that new infections have tremendously gone down, but there's still a lot of gaps, especially for young girls, adolescent girls, and young women, and we need to redouble our efforts in that regard. Similarly to what other colleagues have mentioned, the coverage of children remains a challenge which we need to close up that gap. So indeed, as we commemorate and celebrate the progress which has been made, we appreciate the fact that our journey towards 2025 of making sure that our whole country reaches not only 1990 but 95, that we are committed with our partnership with the PEPFAR, UNAIDS, a global fund, that we can be able to reach that. And of course, ultimately, our 2030 targets of making sure that we can eradicate HIV and AIDS as a public health threat. And as I conclude, again, bring you the message from the government, from the people of South Africa, people living with HIV, to say that we appreciate this partnership, but we also want to say that we urge Congress to make sure that this PEPFAR is reauthorized. We have traveled together a long and successful journey. We have a few miles to catch, and we can only be able to catch those miles together, and we can continue to save more lives and make sure that HIV and AIDS can indeed be defeated as a public health threat. I thank you.
Thank you so much, Minister Fala, always inspiring and always bringing the voice of people served. Thank you so much. We'll now go to Minister of Mozambique, Minister Armindo Tiago. Bom dia. Minister Tiago hosted the leadership of PEPFAR, UNAIDS, and the Global Fund recently in June in Maputo. We want to thank you for that, but also for your country's long leadership in the HIV response. The progress in Mozambique continues to accelerate. Thank you so much, Minister. The floor is yours.
Good morning, good afternoon. Honorable members of Congress, Honorable Ambassador John Nkengasong, honorable ministers present in this meeting, ladies and gentlemen. Allow me, on behalf of the government of Mozambique, to express my warmest regards to all participants in this forum. We express sincere gratitude for the invitation to partake in this event, which reaffirms our collective dedication to eliminate HIV by 2030. It's an honor and privilege for us to present Mozambique's progress and challenges regarding HIV response. Despite recent advances in HIV and AIDS in Mozambique persists as a paramount public health concern. The HIV prevalence among individuals aged 15 to 49 years decreased from 13.2 in 2015 to 12.5 in 2021. However, the prevalence rates are notably higher among women, reaching 2 to 3 times that of men between the age of 15 to 29. According to Spectrum, 22 estimates the population living with HIV in Mozambique stood at 2.4 million. During this period, there were 97,000 new infections and 48,000 new HIV-related fatalities, and a projected vertical transmission rates of 10%. Despite this high burden of HIV, Mozambique continued to make notable progress, given our collective effort to ensure the response is on track and the full alignment to end AIDS by 2030. We acknowledge the support and partnership with PEPFAR, UNAIDS, and Global Fund, which has been crucial to the progress observed so far in our country. Many members of Congress, their staff, as well as top officials of the US government, UNAIDS, and Global Fund have visited recently Mozambique. Each visit has been a critical moment to strengthen our collaboration and to boost the HIV response in our country. We appreciate it. Excellencies, distinguished participants, we take great pride in announcing that Mozambique has exceeded the milestone of 2 million individuals receiving HIV treatment within the public facilities. This achievement positions Mozambique, our program, as the second largest antiretroviral treatment initiative globally. Notably, in 2003, the year where PEPFAR started its support in our country, the number of individuals undergoing treatment was less than 5,000. Over the past 22 years, between 2000 and 2022, the availability of antiretroviral treatment has prevented approximately 1 million HIV-related deaths. Moreover, the vertical transmission prevention program has averted more than 330,000 new HIV infections in children, in line with the 95 targets. Notable achievements have been observed. As an example, by September 2023, 88% of people living with HIV were aware of their serological status, as compared to 36% in 2010. Additionally, 87% of those aware of their serological status were receiving antiretroviral treatment, compared to only 38% in 2010. Among those undergoing treatment, 76% had achieved viral suppression, making a substantial increase from 65% that was observed in 2016. Recognizing the obstacles in reaching the UNAIDS target by 2025, we introduced the Testala campaign. This initiative is aimed to increase awareness about health counseling and HIV testing, specifically in high-risk populations. We rely on ongoing support of the US Congress through PEPFAR to achieve the 2025 targets, secure sustainability of HIV response, and extend our efforts beyond 2030. Excellencies, distinguished participants, the sustainability of Mozambican response to HIV and AIDS stands as a primary concern of the government. As the country ages closer to 95 targets, maintaining this achievement becomes increasingly intricate and costly. Against these backdrops, acknowledging that controlling the epidemic needs a strong commitment from the government and its collaborator, the country has initiated dialogue on sustainability issues. This engagement involves the government, partners, civil society, and beneficiaries of the response. This ongoing dialogue
Obrigado, Minister. I think we've lost connection, but I think you were just wrapping. You were
in the
just
formulation by the agencies. And to conclude by reaffirming Mozambique's heartfelt gratitude to American people, to those that contribute through initiatives like PEPFAR, UNAIDS, and Global Fund, and play a pivotal role in saving lives in our country. Thank you.
Thank you so much, Minister, and thanks for coming back to finish your remarks. We really appreciate that. It is my honor to introduce our next leader, Martha Cameron. Martha is Executive Director of ICW, the International Community of Women Living with HIV in North America. Martha has a very personal story that is profoundly moving. We welcome you to the floor and welcome your remarks. Over to you.
Thank you so much. It's a huge honor and privilege to be here with you all and to support the ambassador and UNAIDS and everybody that has worked with PEPFAR. I'm here to represent my community, the community of people living with HIV, as well as many civil society organizations, not just ICW, the global network of people living with HIV, and here locally in the US as well, the People Living with HIV Caucus, of whom I'm all a part of. It's been a bit overwhelming listening to the statistics over the past few days, knowing that I represent those statistics. I'm originally from Zambia, Africa, which, as you have heard from many of the African leaders, was the epicenter of the HIV epidemic. I lost family and friends, people I knew, and they represent some of those 40 million people that we're saying we lost in the epidemic. And then I myself seroconverted in 2003. And had it not been for PEPFAR, I wouldn't be here today. So when I hear the stories of how PEPFAR came together, the advocacy, the bipartisanship that responded to a crisis in my country and all of Africa, I was also on my deathbed. I was told I had very little time to live. Yesterday I shared that when I was diagnosed, my CD4 was 2, and my viral load was very, very high. And had it not been for me basically overhearing the fact that I needed to hold on because there was help coming from the US, I probably would not have had hope. I didn't mention as part of civil society that faith-based communities as well. My pastor was one of very few people that even acknowledged that HIV existed in his community, let alone his church. And we were galvanized and organized by the faith community to be a part of the response through PEPFAR. So I was one of those first recipients. And every year as PEPFAR has celebrated its success, I continue to represent that success. I recovered, my viral load was suppressed. I ended up getting married. So even when you talk about prevention of mother-to-child transmission, I'm in a serodiscordant marriage, and my children, both my boys, were born HIV-free. Josiah was born in 2009, and he's now a freshman in high school. And Judah was born in 2011, actually here in the United States, which I now call my home, although Zambia will always be my home. But I'm here to just share what this has meant to me personally and what it represents for civil society, for faith-based organizations that have also put their hand to the plow. I consider myself blessed to have recovered, to have had children, but I know that the people that are highly impacted by this epidemic continue to look like me, continue to be in places that still don't have access. There's, we hear 9 million people still need access. It really sort of breaks my heart as over the past few years to see the rise in infections in young girls and adolescents, because my personal commitment, why I continue to do this work, is to ensure that this wasn't repeated in my generation. And so it is a little scary to hear that this funding, PEPFAR, that gave me life, is now at risk, knowing that there are still people that need this help. That if we were to lose this now, it would be a repeat of what happened. We talked about orphans and vulnerable children. I was an orphan. I was considered a child-headed household. And I cannot imagine that there would be more orphans that would come as a result of people losing access to treatment, and that this generation, especially the generations of young and adolescents, we even have young girls who were born with HIV who are now having children. And so my simple remarks or my simple request here today was to just appeal to everybody that is looking at the reauthorization of PEPFAR, working towards that, to hear from me as a person living with HIV, representing my community, representing civil society, representing faith-based organizations, that I've been working in partnership with you, and hope that we can come to a better conclusion of a clean 5-year reauthorization of PEPFAR, so that we do not take 10 steps back and see a repeat of what happened in my generation. Thank you so much for giving me this opportunity today.
Thank you so much, Martha. Nothing speaks more powerfully than your personal story and the voice that you give on behalf of the other millions that are alive and living because of PEPFAR and because of this extraordinary initiative that we must continue. We will continue to move around the room and really highlight the leadership across Congress, across faith-based groups, civil society, countries, and we're so pleased next, ladies and gentlemen, to introduce Representative Hakeem Jeffries, who is joining us online. Since 2023, Congressman Jeffries has served as House Minority Leader and leader of the House Democratic Caucus. Representative Jeffries is a tireless advocate for health, for social and economic justice, and a real champion for the work that we're doing together here and celebrating. Leader Jeffries, welcome. You have the floor.
Morning. Thank you very much for a generous introduction. Thank you all for your leadership, for gathering in the United States Capitol. Welcome, of course, to the citadel of our democracy. And thank you for the extraordinary work that you have done over the last 20 years, and an extraordinary work that will continue to be necessary as we work to make sure we reauthorize PEPFAR. I also want to acknowledge who you may have heard from already, but certainly Congresswoman Barbara Lee, who was a tremendous force of nature behind this program within the House of Representatives 20 years ago, as well as, of course, the work that was done in a bipartisan way, including the leadership from former President Bush. I think it was Dr. King who once made the observation that the arc of the moral universe is long, but it bends toward justice. And I think what Dr. King was suggesting to us is that in this world, we have many different challenges, trials and tribulations, turmoil, and challenges that we have to confront decisively, certainly such as the HIV/AIDS epidemic. And there's some rough folks who aren't necessarily interested in doing the right thing. But in terms of the arc of the moral universe bending toward justice, what I think Dr. King was suggesting to us is that as long as you have some good folks who are willing to stand up and show up and speak up for what is right, then justice will prevail. And PEPFAR is a classic example of just that, in terms of its extraordinary success as a life-saving, life-sustaining, life-changing program. And you have our commitment as House Democrats that we will continue to work with President Biden and our colleagues on the other side of the aisle to make sure that we secure a robust, strong, lengthy reauthorization of PEPFAR. Your presence here today, the articulation of your stories, and the importance of this continuing program based on the challenges that we still face and the success that has occurred over the last 20 years is incredibly meaningful. And we look forward to working together with all of you, civil society leaders, faith-based community leaders, and people of goodwill to make sure that once again, the arc of the moral universe on this issue bends toward justice. Thank you very much.
Thank you so much, Leader Jeffries, for your relentless leadership and your unwavering support of PEPFAR, HIV in Africa. Your call for bipartisan action in support of PEPFAR's reauthorization is inspiring for those of us who are part of the workforce and all our supporters here today. So on behalf of the U.S. government and all the partners here today, please join me again to thank Leader Jeffries and the 4 distinguished leaders from the African Union, Tanzania, South Africa, and Mozambique for joining us online. Thank you all. Shannon, thank you so much for your patience, for being the final speaker on the panel today. Faith-based organizations are at the forefront of the HIV response, and Catholic Relief Services is at the forefront of FBOs. Dr. Shannon Senfeld is the Senior Vice President of CRS, and we welcome you to give some reflections. Over.
Thank you. It's hard to follow all the great speakers that have already gone before me and to be the last speaker standing between you and getting out of here. So thank you for sticking around. I'll be brief. I have had the pleasure of working with PEPFAR since its very inception. I started with PEPFAR, working with PEPFAR programming in Zambia in 2004, 2003, 2004. I've had the pleasure since that time of serving in a variety of roles related to PEPFAR funding and implementing through CRS, Catholic Relief Services, including most recently as a chief of party for one of our orphans and vulnerable children programs. I've seen personally the life-changing pro-life aspects of PEPFAR. It has been astonishing. I was working in Zambia before PEPFAR started, and I remember losing friends on a weekly basis. It was something that was indescribable. And once PEPFAR arrived, it was so different. It was truly something remarkable that is even hard at this stage to put into words, because experiencing it, seeing the difference on a day-to-day basis was powerful and moving, and something that as an American, as a Catholic, as an implementing development professional, I could be extremely proud of. And I was, and I continue to be today. The programming that has been implemented under PEPFAR has been pro-life, life-affirming, life-sustaining, as someone else had said. And it's hard, I'm very hard-pressed to think of another example of such a life-affirming program that has ever been implemented by the U.S. government and faith-based organizations in general. So it has been truly my pleasure to be part of it. I am humbled and honored to be here with so many of you today who have played such an important part in the rollout and support, continued support of this program. It is something that is integral, and it is definitely something that we see affecting millions of lives beyond the statistics that we've talked about. And it is something that absolutely has to continue. So again, it's my pleasure to be here. It's my pleasure to continue to support PEPFAR and its reauthorization over the next 5 years. Thank you.
Thank you all very, very much for joining us today, for your powerful statements and your remarks from all around the globe. I'm going to turn over to Sandy Thurman to offer just some brief closing remarks as we wrap up. Sandy has been with the fight for a long, long time.
Day. It's amazing to be back on the Hill to commemorate another World AIDS Day. But it's so wonderful to see the mix of people, leaders from different countries, from our faith-based partners, from our friends who are living with HIV and AIDS. Just a wonderful mix. And I'm so glad to see all of you here because we want to reflect on the incredible impact that PEPFAR has had, on the wonderful bipartisan support we've enjoyed and will continue to enjoy in this body and the body across the way. And just to thank all of you. It's a wonderful time to reflect. And in a world that's filled with all kinds of difficulties at this point in time, to be able to look at something that continues to save lives every day when we turn on the television and see lives in peril and people being lost every day, the idea that someone would have the audacity not to continue this work in the face of the success that we've had and the troubles that we have in the rest of the world is just unfathomable to me. So I think it's great to hear all these folks in the good fight with us from both sides of the aisle and the extraordinary work that all of you do every day so that we can reach our goals by 2030 of ending HIV as a public health threat. So just thanks to all of you. Mr. Ambassador, it's so wonderful to have you at the helm and all these great leaders at your side. So I think this gives us a good opportunity to celebrate and go out and share our success with everybody in this neighborhood and every place else that we work. So thank you all for being here today. And we look forward to seeing you, some of you later on today, and as we continue this work toward a clean 5-year reauthorization of PEPFAR. Thank you very much.
Thank you very much, Sandy, and thanks to everyone. The event has concluded. We're very grateful to each and every one of you.